So currently we are seeing an increase in number of cases of influenza, which is basically presenting as fever, sore throat, cough, body aches and running nose. H3N2 is a type of an influenza virus which we see every year during this time of the year, but it is a virus which changes over time, it mutates over time and it undergoes what we call an antigenic drift. That is, the virus changes to some extent, and we had a pandemic many years ago which was H1N1. That virus is now, the circulating strain is H3N2 and therefore it is a normal influenza strain, but we are seeing more cases because as the virus mutates a little bit, the immunity that we had against the virus becomes a little less, and therefore people who are susceptible tend to get the infection more easily. And of course, it spreads, like we know about COVID, through droplet, and as we tend to crowd more, we have now stopped our COVID appropriate behavior. The virus has spread much more and caused increase in number of cases. However, I think there is not that much of a cause of concern, because although the number of cases increased, hospitalization has not gone up to a very large extent. Only those people who have associated comorbidities need to be careful. So the virus, which is H3N2, it comes from the family of influenza viruses, and influenza viruses, based upon its various subtypes, has an H and an N name, and it mutates, or it changes slightly every year, what is known as an antigenic drift, and that makes the virus more susceptible. It causes more infection among people who have not had the influenza infection for some time. If the virus changes dramatically, what we call an antigenic shift, as we saw in 2009, then you can have a pandemic. But currently what we are seeing is a mild drift in the virus, which is not a cause of concern. Now, because the virus changes to some extent, it causes a higher chance of mild infection, and that is what we are seeing right now. We also see that during this time of the year, when the weather changes, there is a higher chance of getting influenza, and also because of the fact that we have now come back to a non-COVID state where we are not wearing masks, we are having a lot of crowding. This is also allowing the virus to spread more easily, and therefore if we need to really prevent ourselves from getting influenza, we need to wear a mask if we are going to crowded places. We also need to wash our hands frequently, and also have physical distancing if we are a more susceptible population. For influenza also there is a vaccine, and for the high risk group and the elderly, one would also say that they can take the flu shot or the influenza vaccine, which will give them protection as far as severity of disease is concerned. So among the festive season, and we have Holi just around the corner, I would really say that people should celebrate Holi, but be careful, especially the elderly and those who have underlying comorbid conditions like chronic respiratory diseases, heart problems, patients of kidney problem who are on dialysis. They need to be careful about going into a crowded place and getting an exposure. If you have to go to a place which is very crowded and it's an indoor place, I would say wear your mask, wash your hands frequently, and if possible avoid going that. You can celebrate Holi more outdoors, and if you do that in an open area which is outdoors, then chance of getting the infection is much less.